Hi, so today this presentation will cover the topic of forearm compartment syndrome. Some of the topics we will discuss include what the condition is, some signs and symptoms to look out for, how to diagnose and treat the condition, as well as what happens after any treatment is done. So what is forearm compartment syndrome? Compartment syndrome is a condition in which elevated tissue pressure inside a small compartment impairs the circulation and function of the contents. This occurs when pressure is increased over a specific threshold for an extended period to impair capillary perfusion. Basically, there is pressure built up in the compartments of our forearm that restricts or reduces the flow of blood, the fresh oxygen, and the necessary nutrients to the muscles and nerves. Compartment syndrome is an extremely painful condition. So, the mechanism of injury for forearm compartment syndrome can be caused by many reasons. Some of the causes include burns, bleeding disorders, anticoagulation therapy, tight casts or dressings, and in rare cases, snake bites. However, the most common cause is through trauma such as fractures of the midshaft radius and ulna, crush injuries, gunshot wounds, and contusions. So some of the structures involved are the muscles of the forearm, typically the flexor digitorum profundus and flexor pollicis longus are the ones most commonly affected due to them being deeper and closer to the bone. The radial, medial, and ulnar nerves supply the forearm, with the median being the most often damaged since it runs through the volar compartment. And according to Starkey, the forearm consists of four compartments, which includes the superficial volar, deep volar, dorsal, and the mobile wad. So if you look close in the picture, you can kind of see the muscles of the forearms that are kind of typically impacted through forearm compartment syndrome. Signs and symptoms to look out for compartment syndrome include visible bulging or swelling around the muscle pain, which is more intense and severe than typical muscle soreness, tightness or numbness due to the loss of restriction, severe pain when stretching, change in skin color or temperature, tingling or burning feeling underneath the skin, and the muscles feel fuller, firmer, or bigger than normal, and in some cases, blisters. So, to determine whether a patient has forearm compartment syndrome, some medical history and background is necessary to be able to rule in and out other possible conditions. Some questions you can ask are: have you had any previous conditions, injuries, or surgeries before? How long has the pain been present? Have you taken any medications? Can you describe what the pain feels like? Do you have any numbness, tingling, weakness, or any difficulty moving the arm? What makes the pain worse? What makes it better? Has there been any change to your daily living activities? Are you participating in any activities that aggravate the affected body part? Or have you been involved in any traumatic event? So gathering the medical history and background can help establish whether the individual is experiencing compartment syndrome or if there is another reason as to why they are feeling the way they are. Usually you can take in their signs and symptoms to assist in making the diagnosis. When observing for compartment syndrome, some patients have some key observation symptoms to look out for, which include the swelling, pale or pink tint to skin, weakness of movements, faint pulse, or bulging of the muscle. So in the picture on the left, you can clearly see that pressure within the forearm has created blisters, as well as causing the arm to swell. And if you look towards the phalanges, you can very noticeably see the swelling from the pressure within the compartment. And in the picture to the right, you can see some slight tint of skin discoloration that is caused by the condition. So when palpating, you're looking for the 6 P's associated with compartment syndrome that will help assist in diagnosing. And these 6 P's include pain, pallor, which is redness coloration, pulselessness, paresthesia, which is abnormal feeling of the skin such as tingling, numbness, itchiness, etc., paralysis, and change in temperature or coolness of the skin. So when you palpate, it would be best to palpate distal to proximal. So you would start the palpation at the posterior side of the arm, move your way down to the wrist. Also note that there may be swelling along with sensitivity to touch. And once you move your way around the posterior muscle, palpate on the anterior side following the same process. So typically when you usually ask questions about how the patient is feeling, that'll help make the examination go by easier rather than having to palpate the sensitive limb. However, it would be best to do so anyway so that you can determine whether the pain is referred, localized, or the obvious signs of compartment syndrome. In regards to special tests for forearm compartment syndrome, there is no clear method to diagnose the condition with special tests. Only physical examination can usually assist in diagnosing, but according to Starkey, the signs and symptoms may be unreliable, so therefore it is warranted to refer a patient if compartment syndrome is suspected. The golden standard to diagnose compartment syndrome is through compartment pressure measurement, which normal compartment pressure varies between 0 to 8, and critical pressure is anything that is above 30. And so here's a picture of what the compartment pressure measurement looks like. And the device used is a manometer, which detects the intracompartmental pressure by measuring the resistance that is present when a saline solution is injected into the compartment. So in the picture with the hands, you see the manometer is being injected into the forearm, which releases the saline solution, and the resistance will be shown through the manometer. So referral and imaging is best to be done if a patient is suspected to have forearm compartment syndrome, especially to help further the evaluation. And in further evaluation to diagnose, the patient will be tested using compartment pressure measurement as well as using MRI and X-rays. So here are some images that you can use to look at and see what the MRIs and X-rays would look like. And so in the top picture, you can see an MRI of the forearm showing edema of the subcutaneous tissue and the flexor muscle compartments. And then the picture to the right of the MRI is a CT showing the left pleural effusion and severe edema of the precordium. The bottom pictures, you can see an X-ray of a distal radius and ulnar break, which causes swelling. And so for acute care of the patients with compartment syndrome, it would first steps to take would be to relieve the pressure, which includes administering oxygen, elevating the arm using a sling, breaking or removing tight casts or dressings, and then ensuring that blood pressure returns to normal due to perfusion causing the blood pressure to lower and could potentially cause more harm. So as you look in these videos or the pictures, you see dressing and cast being cut off, a doctor placing a patient into a sling, and blood pressure being taken. So the reason to remove casts or dressings is because it could be causing tighter restrictions to the arm and irritate the patient even more. So removal of these materials will be able to release some of the pressure built up from the tight restricted materials. The typical acute care for compartment syndrome is surgical intervention in the form of urgent forearm compartment fasciotomies. According to Starkey, the procedure should be done within 6 to 12 hours to optimize the outcomes due to the high rate of complications. And post-surgery, the incision is left open and covered with sterile wet to dry dressings with irrigation and debridement within 72 hours following the procedure. If the acute compartment syndrome is not treated immediately, permanent nerve damage and loss of muscle function can occur, and if surgical intervention is delayed, amputation will be the last resort if the affected limb no longer has function, which chronic care is where the condition and pain and any symptoms has been going on for longer than what an acute care or a stage would seem like. So in case of compartment syndrome not being immediately treated or diagnosed, the damage may become extent to the point that damage to the structures of the forearm may already be compromised, and amputating the limb would be the resulting choice. So at this stage, there would be no way to retrieve function if the damage has already been done. However, this typically occurs with chronic compartment syndrome when the symptoms have been going on for longer periods of time compared to acute compartment syndrome. As you see at the picture, this is what it would kind of look like during operation as for a compartment fasciotomy. So after surgery or any kind of treatment, some of social the social determinants of health heavily impacts to how patients will respond to being diagnosed with a compartment syndrome. So some key factors that medical professionals should be aware of is the state of being the patient is in regard to mental, emotional, financial, and environmental health. And so some key questions to ask is how is their state of mind? Do they have the means necessary to go through the procedure? Is there any support at home? How does the condition affect them in their daily lives? Is there any motivation to progressively work hard to heal? And so you kind of have to think about whether or not the condition alters the routine of the patient. If they're working and the pain is severe enough that they cannot work, they are already becoming withdrawn from that environment. So mental health has a large role in making sure the patient is all right to undergo any treatments because you may be able to help them with the condition, but you and alleviate the pain, but how long will they have to be away from their normal schedules? How long will they have to be away from the people they see on a regular basis? So, do they have the people to help them recover and bring them back to interact with those people again? Do they have the necessary contacts in case things are not looking up to what they believed would happen as they go through the recovery process? And so, this concludes compartment syndrome for the forearm and how to kind of diagnose it through signs and symptoms, but if you're not completely for sure it is, it'd be best to just refer if the patient is suspected of having the condition.